it. Don't fan
it out.
Let me take it off. Hey everybody, welcome to the Older Adult Live podcast. Today you will have my husband, this is Corey Blankenship, and then me, Shelby Blankenship. I'm one of your TAs and a fellow physical therapist that owns Southern Grit. And we are going to be talking about how you can handle a worst case scenario and what best practices to do that with. So as we know, CPR training is required for pretty much every healthcare professional. And so what we're going to talk about is a little bit of the ins and outs of what is very appropriate for us to do, what are some pitfalls that my husband has seen on the job, and how we can optimize that, and some of the aftermath of having to do CPR or a situation like that. So let me just interview my husband real quick, and I'm going to ask you, when it comes to CPR, what are things that as healthcare professionals that we need to know for our jobs?
One of the things you have to remember is that when it comes to CPR, we really want what they call like high quality CPR. And in high quality CPR, you are minimizing interruptions as much as possible. So kind of the standard for years has been 30 compressions, 2 breaths. Well, that adds up to a lot of pauses and a lot of interruptions in CPR. So what we see a lot of time in my profession is it's more effective to do continuous compressions rather than stopping every 30 compressions to check to see if somebody's breathing. Another thing to remember is you don't want to do CPR if somebody has a heartbeat. And I know that sounds kind of silly to say, but we see that very often where chest compressions are started on somebody who does have a pulse, and it's not necessary.
Right. Now, when somebody's trying to check for a pulse, what are areas where they tend to mess up and they assume they don't feel that heartbeat?
Well, there's 2 things that people do. They either don't check the right area, so you want to be checking right in here, or if you're checking, with your own hand and you're using your index and middle finger, you can feel your own pulse sometimes, and that can give you a false reading. So using the middle and ring finger is a little more effective.
A little bit less sensitive.
Yeah. If you're having trouble feeling the pulse in here, also feeling like on the inside of the groin is another really effective place to check for one.
Okay, very good. What about like for some of our, we primarily deal with a lot of older adults, and sometimes, they might have like extra adipose tissue. So would you recommend going for here, or would you recommend going for radial, femoral? What would be the best practices for that?
Here first, because that's going to be stronger than a radial. After that is when I would go femoral, but the closer to the trunk is where you're going to get the strongest pulse, and that's going to give you the best indication.
Okay. So when it comes to CPR, it's not just the compressions, but I know it also, the breathing aspect. What would you recommend for somebody who is like a one person doing CPR? What, obviously we want to focus mostly on doing the compressions. Mm-hmm. If a second person comes, what is their job?
So the first step is going to be that one person is going to call 911. You want to get other resources there as quickly as possible. But then, like we talked about, you're going into the uninterrupted CPR, continuous compressions. When you get somebody there, probably the most important thing, if it's just the 2 of you, is going to be taking turns and swapping out probably every 90 seconds or so. CPR is really exhausting if you're doing it well. It's 100 to 120 beats per minute is what you're shooting for. So after 90 seconds of it, you're going to be wiped out. And depending on what the EMS response time is, you may have 10 to 15 minutes before somebody else gets there. So between the 2 of you, swapping every 90 seconds so you're able to get back in and get back on good, strong compressions is going to be really important.
Okay. And then what about like the breathing aspect? Is that something we should completely ignore? Like what if we have extra items like you have with here? What should we do?
Yeah, so what I would really recommend is having one of these in your clinic or whatever setting you're in. This has a lot of names, a bag valve mask, BVM, or an ambu bag. These are great because it totally eliminates the need for that mouth-on-mouth compression, which is just kind of nasty. And honestly, I would never recommend doing that. But you also have the option to hook this up to oxygen. So if first responders arrive on scene, they can hook that to their oxygen tanks. That's going to supplement what you're doing. These are very effective. But knowing how to use this properly, you're not just going to slap it on somebody's mouth and squeeze it as hard as you can. You're